A ratio of left atrial to aortic diameter exceeding normal limits indicates left atrial enlargement. This ratio is most useful when subjective visual estimate of left atrial enlargement is questionable. Left atrial size is used along with patient symptoms, blood pressure, and other cardiac ultrasound findings to determine the stage of mitral insufficiency and the timing and type of treatment to be given. The right side short-axis M-mode measurements of the aorta and left atrium can be very helpful. In dogs, the left atrial diameter usually equals aortic diameter. The left atrial diameter is divided by the aortic diameter to obtain the ratio. In most ultrasound machines, this standard calculation is done automatically and listed on the patient report. The normal M-mode left atrial to aortic ratio, LA-AO ratio, in the dog is 0.83 to 1.13. Ratios lower than 0.83 indicate an inaccurate left atrial measurement, usually due to poor placement of the M-mode cursor. Ratios greater than 1.13 indicate left atrial enlargement. Medical therapy should be initiated if the M-mode LA-AO ratio is greater than 1.6. There is a problem with this measurement. In many dogs, the M-mode cursor crosses and measures the left auricle and not the left atrium. With mitral insufficiency, the left atrium will enlarge before the left auricle does. Therefore, some animals with mitral insufficiency and left atrial enlargement will show a normal measurement of the left auricle and a normal LA-AO ratio as calculated by your machine. The two-dimensional LA-AO ratio has been developed to help address the deficiency of the M-mode LA-AO measurement. A good right-side short-axis two-dimensional view of the aorta is called the Mercedes sign because the aortic valve resembles the Mercedes emblem when the valves are closed. The aortic valve has a non-coronary cusp, a right cusp in contact with the right atrium, and a left cusp in contact with the left atrium. In the Rishnu method, aortic diameter is measured vertically along the line between the non-coronary cusp and the right cusp. Then the left atrium is measured along the line beginning at the left atrium, between the non-coronary cusp and the left cusp, to the left atrial free wall. The normal ratio for dogs is 0.8 to 1.6. Values exceeding 1.6 indicate left atrial enlargement. With gross left atrial enlargement, dilated pulmonary veins are often seen at the left atrial free wall where the left atrial measurement is made. Avoid including a pulmonary vein in the measurement by estimating where the curve of the left atrial free wall should be. In the Swedish method, the aorta is measured along the line between the non-coronary cusp and the left cusp. The left atrium is measured as a continuation or extension of this same line to the left atrial free wall, being careful not to extend the measurement into a pulmonary vein. The normal ratio is 0.9 to 1.3. Ratios exceeding 1.3 indicate left atrial enlargement. Note the right main pulmonary artery, RMPA, as it crosses over the dorsal left atrium on its way to the right lung lobes in this right side long axis four-chamber view. In mitral regurgitation, these pulmonary arteries are anatomical structures you need to recognize. Notice how the right main pulmonary artery increases in size as it fills with blood during ventricular systole. Pulmonary veins can be seen entering the left atrium in the right side long axis four-chamber view. Two veins are commonly seen entering the dorsal left atrium near the atrial septum. Two more can sometimes be seen entering the left atrium near the left atrial free wall. The pulmonary veins can also be seen from the left apical four-chamber view in this dog with mild mitral regurgitation. Color flow helps identify the veins, and turbulence of the insufficiency does not enter the veins in mild cases. Two veins enter near the left atrial septal wall, and two more near the left atrial free wall. As mitral insufficiency progresses, these pulmonary veins dilate and become prominent. In severe mitral insufficiency, color flow turbulence extends into the pulmonary veins and indicates reverse flow of blood from the left atrium back into the lungs.